Welcome back to the Deep Dive. Today we're taking a plunge into a really critical topic for anyone who cares about horses, neonatal foal pneumonia. If you've ever been around newborn foals, you know they're incredibly delicate. And this condition, well, it can range from mild to absolutely life-threatening. It's often linked to their unique vulnerabilities in those first few weeks.
Yeah.
You've given us a stack of sources, and our goal today is simple. We're going to pull out the absolute must-know insights, what causes it, how we spot it, what the treatment looks like, and what the chances are for these little guys.
It's definitely a complex challenge in equine neonatology, for sure. And we've got some incredibly comprehensive material here to guide us through it. It really demands a clear understanding.
Okay, so let's just jump right in then. When we think about why foals are so particularly susceptible to pneumonia, especially with their developing immune systems, what's the single biggest red flag, the most significant factor?
Right. Without a doubt, it's something called failure of passive transfer, FPT.
FPT.
And think of it like this. Foals are actually born with almost no immune defenses, like none.
Wow.
They rely entirely on getting this protective shield of antibodies, specifically IgG antibodies, from their mother's first milk, the colostrum.
Right, that liquid gold.
Exactly. And they have to get it within those first 12 to 24 hours of life. If they don't get enough, or maybe their gut can't absorb it properly, well, they end up profoundly vulnerable. It's almost like their immune system isn't even online yet. And this leaves them wide open to any infection, basically. Pneumonia is, unfortunately, a very common result. It's really the foundation for a lot of other problems down the line.
That failure of passive immunity just sounds like such a profound vulnerability right out of the gate.
Yeah.
It makes you wonder what else could possibly go wrong. Are there other major ways, maybe even mechanical ones, that lead to pneumonia besides just that immune weakness?
Yes, absolutely. Another huge category is what we call aspiration pneumonia.
Aspiration. So breathing something in.
Exactly. Something other than air gets into the lungs. And we see a few main types.
Okay.
First, there's meconium aspiration. Meconium, that's the foal's first feces, right? If they inhale this during a difficult birth, maybe a prolonged one, it's not only irritating to their delicate lungs, but it also creates a perfect breeding ground for bacteria.
Oh, nasty.
Yeah. Second, there's milk aspiration. This is sadly common in foals that have trouble nursing or swallowing. Maybe they have a poor suckle reflex or a physical issue like a cleft palate, or even neurological problems like neonatal maladjustment syndrome, NMS, dummy foals sometimes called, where they're just not quite connecting right after birth or simply too weak.
Right.
Inhaling milk is incredibly irritating to the lungs and can lead to really severe bacterial pneumonia. And, there are even other risk factors here like botulism, severe infections, certain muscle conditions, or even issues caused by us humans, like if they're syringe or bottle fed improperly.
Okay, so that's another route.
Well, and third, there's reflex aspiration. This is when foals with stomach issues like slow gut movement, ileus, or maybe gastric ulcers might actually aspirate stomach contents back up into their lungs.
Wow. So it sounds like a whole different pathway then. Not just infection getting in, but literally something getting into their lungs that shouldn't be there. That must be incredibly challenging to manage.
It really is.
What about direct infections then? What are the usual bacterial suspects we're typically up against?
Well, for bacterial infections, we can see bacteria directly inhaled, maybe from the environment or even from the mare's reproductive tract.
Okay.
Or they can spread from a systemic infection. We call that hematogenous spread, basically traveling through the bloodstream from another site in the body, like maybe an infected navel or joints, and then settling in the lungs.
Got it. So what bacteria are we talking about?
The most common ones we see are Streptococcus equine bit of a mouthful, but very common.
Right.
And Escherichia coli. E. coli, especially in very young foals who have a widespread infection, septicemia. We also look for Klebsiella pneumonia and Actinobacillus equine. And it's worth noting, Rhodococcus equi is famous for causing foal pneumonia.
Ah, yes, our equi.
Yeah, but usually in slightly older foals, typically 1 to 6 months old, it creates these really tough lung abscesses.
Right.
However, severe early onset cases can absolutely happen in neonates too. And there's a whole range of others, bacteroids, Clostridium, Pasteurella, Pseudomonas, but those first few are really the main players we see most often.
Okay. And viruses. Can they also cause pneumonia directly or maybe just, open the door for these bacteria?
Yes, viruses can definitely play a significant role. Things like equine herpes virus, EHV1, or for equine influenza, equine adenovirus. They can directly cause pneumonia. But more commonly, what they do is damage the foal's respiratory defenses. They sort of weaken the barriers, clearing the way for a secondary bacterial pneumonia to take hold.
Ah, okay, so they pave the way.
Exactly. Foals can even be infected with these viruses before they're born or very shortly after. And unfortunately, viral pneumonia in neonates is often rapidly progressive and usually fatal.
Oh, that's grim.
It is. It's particularly devastating to see in Arabian foals with SCID that's severe combined immunodeficiency. They're exceptionally vulnerable to equine adenovirus.
Right, because their immune system is already compromised.
Precisely.
So beyond the foal's immediate health and these specific bugs, what about the environment they're born into? Does that play a role?
Absolutely. Environmental factors are crucial. Poor hygiene, an unsanitary foaling stall, even just overly dusty bedding. It can dramatically increase the amount of bacteria a foal is exposed to right from the start.
Makes sense.
Overcrowding or, say, poor ventilation in a foaling barn can also contribute to the spread of pathogens. And simple things like cold or wet stress can further suppress an already developing immune system, making them even more vulnerable.
So we've got the immune system, these mechanical issues, specific bacteria and viruses, and even the environment itself. Are certain foals just generally more at risk, even before all these factors come into play?
Yes, definitely. Foals born prematurely, or those that are dysmature, meaning they're full term but maybe physically underdeveloped,
Sure.
or any foal that's otherwise compromised at birth, they're inherently weaker. They have less developed immune systems. Their little bodies just aren't quite ready for the world yet.
Yeah.
And we also look at maternal risk factors. Was the mare sick during pregnancy? Maybe colic or respiratory disease? Did she have a difficult birth? Dystocia? Did she run milk before foaling, losing some of that vital first colostrum? Or perhaps she didn't produce enough milk, or worse, rejected the foal. Even the mare's age, very young or very old mares, can affect the quality of the colostrum. And on the foal side, beyond prematurity, things like a difficult birth, that NMS we mentioned, or any musculoskeletal issue that prevents them from getting up and nursing right away, or even just prolonged lying down, that can increase their risk too.
It's just incredible to think about the sheer number of factors that can contribute here. That's kind of overwhelming. And it's important to note just how prevalent this can be. Our sources indicate neonatal foal pneumonia can affect up to half of the foals examined at referral hospitals.
Yeah, it's a big number.
And here's the kicker. Most cases are seen in foals less than 14 days old, with the average age of presentation being under a week. That's such a tiny window for such a serious condition to take hold.
It really is. Time is absolutely critical.
Okay, here's where it gets really interesting, I think. We've talked about all the ways it can sneak in. Now, the crucial question: how do we, as guardians of these vulnerable lives, even begin to spot this silent threat? Because as you mentioned, the signs can be incredibly subtle, making early detection a true race against time.
That's the challenge, isn't it? Early diagnosis is absolutely critical because pneumonia can become severe incredibly fast in these foals. And what's fascinating here, and often missed, is that foals can have quite severe lung disease without showing the obvious respiratory signs you might expect.
Right.
They often just look off, things like lethargy, not wanting to nurse, maybe a fever, although their temperature can even be normal or actually low in really severe cases.
So not always a fever.
Not always. And this is key. A cough or nasal discharge. Those are actually not common findings in the early stages of full pneumonia.
Wow, that's really counterintuitive, isn't it, for
Okay,
pneumonia?
it is. That's why just relying on those signs alone is a dangerous mistake. You can miss it.
That's a huge insight.
Yeah.
So if we can't always rely on a cough or a runny nose, what are the actual clinical signs that should set off alarm bells?
Well, the most consistent and often the earliest sign is simply an increased respiratory rate. Dead shipnea, we call it. Just breathing faster than normal, often in a shallow, rapid pattern.
Okay, faster breathing.
Yeah. As it gets worse, you'll start to see increased respiratory effort dyspnea. They're actually straining to breathe.
What does that look like?
It can look like flared nostrils, or you might see an abdominal heave line where their stomach muscles are visibly working hard to push air out, or even open mouth breathing, which is a very, very grave sign in a foal.
Okay, yeah, that sounds serious.
And when a vet listens to the lungs, performs auscultation, they might hear abnormal sounds like crackles or wheezes, or maybe muffled sounds if areas of the lung are inflamed and filled with fluid. That's called consolidation. Or if there's fluid accumulating around the lungs, pleural fluid. Systemically, beyond the breathing, you look for that fever if it's there. General dullness or depression, a poor suckling reflex or just refusing to nurse,
Yeah.
and maybe a general failure to thrive or even weight loss.
Okay.
If they're not getting enough oxygen hypoxia, you might notice their gums look pale or even bluish. Cyanotic. And if a widespread infection, sepsis, is also involved, you'll see other signs like bright red gums, maybe a slow capillary refill time. You press on the gum, the color takes too long to come back.
Yeah, know that test.
Or tiny red spots on the gums, petechiae, indicating a problem with clotting, and their heart rate would usually be increased too.
Okay, so a lot to watch for, even if it's subtle at first. Beyond just observing the foal, then, what are the essential diagnostic tools a veterinarian would use to really confirm this and figure out what's going on inside?
Right, so after a thorough physical exam, listening carefully to the lungs, checking all the vital signs, the next step is usually blood work.
Okay.
A complete blood count, or CBC, can give clues. It might show an elevated white blood cell count, often with more immature cells, which points towards a bacterial infection. But interestingly, in overwhelming infections, the white cell count can actually crash, be very low.
Oh, okay. Paradoxical.
Exactly. And we look for toxic changes in those white cells too. But one of the most important tests is for acute phase proteins, particularly serum amyloid A, or SAA.
SAA, yeah, I've heard of that becoming more common.
It's super sensitive and reacts very quickly to inflammation. It's excellent for early detection and also really useful for monitoring how well the foal is responding to treatment.
Oh, okay.
We also critically check serum IgG concentration. That tells us about that passive transfer from the mare. If the IgG is low, say below 400 milligdl, that foal is definitely immunocompromised. Major risk factor.
Right, confirming that FPT.
Precisely. Then there's blood gas analysis, essential. It tells us how well the foal is actually oxygenating its blood and getting rid of carbon dioxide. If those levels are off, like PaO2 below 60, it signals their breathing system is really struggling. PaO2 over 60 means respiratory failure might be looming.
Critical information.
Absolutely. And we might also do a blood culture, especially if we suspect sepsis, to try and identify the specific bacteria causing the problem systemically. That helps guide antibiotic choice.
Makes sense. What about looking inside? Imaging.
Yes, imaging is highly recommended. Thoracic radiography x-rays is fantastic.
Chest x-rays, okay.
Yeah. They can show changes in the lung tissue, like those consolidation patterns or even lung abscesses or fluid around the lungs' pleural effusion. X-rays are also invaluable for tracking how the disease is progressing or hopefully resolving over time.
So you do serial x-rays.
Often, yes. Then there's thoracic ultrasonography. Ultrasound. It's a really useful tool, especially good for looking at the surface of the lungs, finding pleural fluid, or identifying superficial consolidations or abscesses that might be right up against the chest wall.
Okay, so it complements the x-rays.
It does, and for the most detailed picture, particularly for complex cases or subtle lesions, a thoracic CT scan is even more sensitive than either x-ray or ultrasound, though obviously that's more specialized.
Right, requires specific equipment.
Exactly. And finally, lower airway sampling is really critical for guiding treatment. Procedures like a transtracheal wash, TTW, or a bronchoalveolar lavage, BAL, involve safely collecting samples directly from the lungs.
Down into the airways.
Yep. This lets us look at the cells under a microscope, cytology, and most importantly, culture the bacteria to figure out exactly what organism we're dealing with and, crucially, what antibiotics it's sensitive to.
That targeted therapy seems key.
It's absolutely key for success. Other things we might do include using an endoscope, a little camera, to look at the upper airway, especially if we suspect aspiration is the cause, or using a pulse oximeter on the foal's tongue or ear to get a quick, non-invasive estimate of their blood oxygen levels.
Okay, so a whole battery of tests to get the full picture. We've walked through the causes and how incredibly tricky it can be to diagnose. What does this all mean for actually treating these little ones? It really sounds like it's an intensive battle given everything we've discussed.
Indeed it is. It's a very intensive battle. Treatment for neonatal foal pneumonia is aggressive, it's often prolonged, and it almost always requires intensive care in a veterinary hospital setting. It's definitely not a wait-and-see kind of situation.
No kidding. So what's the first line of defense? That immediate action once pneumonia is suspected or confirmed?
Antimicrobial therapy, antibiotics, absolutely crucial, and started immediately, aggressively.
Right away.
Right away. We usually start with broad-spectrum antibiotics, typically a combination that covers a wide range of the likely bacterial culprits. Common choices are things like penicillin combined with an aminoglycoside like gentamicin or maybe a cephalosporin like ceftiofur.
Covering the bases.
Exactly. If we suspect anaerobic bacteria might be involved, maybe from aspiration, we might add metronidazole. And if Rhodococcus equi is a big concern, perhaps on a farm where it's known to occur, we'd use specific drugs like macrolides, azithromycin, or clarithromycin, usually combined with rifampin.
Okay.
This initial therapy often starts before we even get those culture results back from the lung samples or blood.
All right, you can't wait.
You can't wait. Then, once we do get those results, we fine-tune the antibiotic regimen to target the specific bacteria that were identified and what they're sensitive to. And here's a critical point. This is long-term antibiotic therapy,
How long are we talking?
often 3 to 6 weeks. And for artichokores, it can easily extend for months. You absolutely can't just stop when they start looking a bit better. The infection can linger deep in the lungs.
Wow, okay, weeks or months. What else is part of this intensive care regimen for these foals, beyond just the powerful antibiotics?
Well, beyond the antibiotics, many foals need oxygen supplementation, usually given via a small, soft tube placed gently in their nose, nasal insufflation if they're having trouble breathing or their blood oxygen levels are low.
Okay.
For inflammation and fever, we cautiously use anti-inflammatory therapy, typically with NSAIDs like flunixin, miglumin, or ketoprofen. But it's really important to know corticosteroids are generally avoided in these cases
Why is that?
because they suppress the immune system, and that can actually make a bacterial pneumonia much worse. You don't want to dampen their own defenses when they're fighting infection.
Got it. Makes sense.
The supportive care is truly where the intensive part comes in. This includes things like IV fluid therapy to keep them hydrated, correct electrolyte imbalances, and support circulation.
Fluids are key.
Absolutely. Nutritional support is vital. If a foal is too weak or unwilling to nurse effectively, we have to ensure they get calories. We might carefully milk the mare and feed the foal that colostrum or milk via a bottle, or more often, a soft nasogastric tube. We also often give IV dextrose if their blood sugar is low.
Right, keep their energy up.
Exactly. And remember FPT, that failure of passive transfer. Plasma transfusion is crucial if FPT is diagnosed. Giving IV plasma provides those essential antibodies they missed out on from the mare. It's a lifesaver.
Like a jumpstart for their immune system.
Precisely. To help clear mucus and secretions from the lungs, we often use nebulization. That's having them inhale a mist, usually sterile saline, sometimes with a bronchodilator drug like albuterol mixed in to help open up the airways.
Like an asthma inhaler for foals.
Kind of, yeah. And we also use a technique called coupage. It's a gentle, rhythmic clapping or patting on their chest wall to help loosen secretions so they can cough them up or clear them more easily. We also often give gastroprotectants, like omeprazole, to help prevent stress-induced stomach ulcers, which are common in sick foals, especially if they're on NSAIDs.
Right, protecting the gut.
And it really boils down to constant, meticulous nursing care, keeping them warm, dry, clean, frequent monitoring of all their vital signs, temperature, heart rate, respiratory rate and effort, gum color, monitoring their appetite and attitude. Daily physical exams are standard, along with repeat blood work, checking that SAA, fibrinogen, CBC, to track their progress in response to treatment.
It sounds like round-the-clock care.
It often is. In the most severe cases, if their lungs are failing despite oxygen therapy, they might even need mechanical ventilation, basically, a breathing machine. And very importantly, we keep their activity to a minimum, strict stall rest to conserve their precious energy for fighting the infection.
Wow, that is incredibly comprehensive. It really highlights the seriousness. So, after all that, what's the general outlook for foals who get pneumonia? It sounds like such a tough battle.
The prognosis is generally described as guarded to fair, which means, yes, it's serious, but there's certainly a decent chance of survival with appropriate care.
Okay, guarded to fair.
The good news is that the prognosis has improved significantly over the years, really thanks to these advancements in intensive neonatal care and diagnostics. Our sources suggest that approximately 2/3, so maybe around 65–70%, of foals treated for pneumonia in a hospital setting survive to be discharged.
That's actually better than I might have guessed, given how sick they get.
It is encouraging. However, it's a stark reality that viral pneumonia in these young foals is unfortunately usually fatal. The viruses can just overwhelm them very quickly.
Right. So what factors, then, point towards a better outcome? What gives these foals a better shot at pulling through?
Well, factors associated with a better prognosis definitely include getting that early diagnosis and starting aggressive treatment right away. Time is of the essence. Successfully resolving that failure of passive transfer with plasma transfusion is a huge positive prognostic indicator. Identifying the specific bacteria causing the infection so you can use targeted antibiotics, That helps a lot.
Makes sense.
If the disease looks relatively milder on the initial x-rays, that's generally a good sign too. And crucially, if the foal shows a good clinical response to treatment within the first few days, they start perking up, breathing easier, maybe nursing better, that's a really strong indicator they're on the right path to recovery.
Okay, so early intervention and positive response are key. What about the other side? What makes it a tougher road? Things that worsen the prognosis?
A tougher road is definitely indicated by a delayed diagnosis or delay in starting treatment. Also, the presence of severe underlying conditions, for example, if the foal is already profoundly septic, or if they were born very premature, or have severe neurological deficits that affect their ability to swallow or even just stand and move.
Right, complicating factors.
Exactly. Developing complications is also bad news. Things like lung abscesses, especially with R equid, or developing severe fluid around the lungs, pneumonia, or even getting holes between the airways and the chest cavity called bronchopleural fistulas. That's very serious.
Yeah.
Severe, persistent low oxygen levels, hypoxemia, despite oxygen therapy, is a poor sign. And unfortunately, the development of laminitis as a consequence of the systemic inflammation can also occur and dramatically worsens the prognosis.
Laminitis too, wow.
Yes. And sadly, other factors include infections with antibiotic-resistant bacteria, making treatment much harder. Or sometimes the limiting factor is simply a lack of owner resources to commit to such intensive, prolonged, and often expensive hospital care.
That's a tough reality.
It is. But it's important to mention, while many foals that recover can go on to live normal athletic lives.
That's good to hear.
It is. But some may have residual lung damage things like scarring, fibrosis, or just reduced overall lung capacity. And that could potentially affect their future athletic performance, especially in really demanding disciplines like racing or high-level eventing.
It's something to keep in mind for the future then.
Yeah.
So wrapping this section up, is there one key takeaway, one really big message for prevention, given how serious and relatively common this is?
Absolutely. If there's one thing to take away for prevention, it's this. The single most important measure, hands down, is ensuring adequate transfer of passive immunity within those critical first 18 to 24 hours of a foal's life.
Back to the FPT and colostrum.
Exactly. Making absolutely sure that foal gets up, nurses effectively, and absorbs enough high-quality colostrum from the mare. Checking their IgG levels around 12-24 hours old is highly recommended. That good colostrum intake is their first, and often their very best, line of defense against so many neonatal problems, including pneumonia.
That was such a clear and really insightful deep dive. We've really covered the full picture of neonatal foal pneumonia, haven't we? From its multiple, sometimes surprising causes like aspiration, to the subtle clues we need to look for, and then the truly intensive efforts required for both diagnosis and treatment. It really brings home what a battle it is for these tiny, vulnerable lives.
It truly does. And I think the critical importance of recognizing those often subtle initial signs like just faster breathing, maybe being a little quiet and acting swiftly, cannot be overstated. Given how rapidly this disease can progress in these newborns, early intervention really can make all the difference in the world between a positive outcome and a tragic one.
Absolutely. So as we wrap up this deep dive, thinking about everything we've discussed, the immense vulnerability of these newborn foals, that critical tiny window for intervention, what future innovations, maybe in diagnostics or preventative care, do you think could really shift the odds even further in their favor down the road? What are you hopeful about?